Hello everyone, I am Dr. Ashima Alex, Assistant Professor, PhD Scholar, Department of Obstetrics and Gynaecology, Yenepoya Homeopathic Medical College and Hospital, Naringana. Today I am going to discuss about the topic early puberty in children. Early puberty is common and understanding its implication is very important or it's very crucial by parents, teachers and healthcare professionals. So let's understand, okay, are our students or our children are growing up too soon? Understanding and preventing early puberty in girls and boys is essential. In this session, you will be able to understand what is early puberty and its implications, understand the biological and environmental causes of early puberty, identify warning signs of early puberty in girls and boys, recognize the risk factors contributing to early puberty, and explore the strategies to prevent and manage the early puberty. So, what is normal puberty? So, we can understand that puberty is the time when a person's body and mind mature and they become sexually and reproductively capable. It is a process that involves hormonal and physical changes. So, it is when a child's body begins to develop and change, a transition from childhood into adulthood. So, what is the timing of puberty? In a healthy children, the normal age of pubertal onset in girls is 18 to 13 years and for boys it's 9 to 14 years. So what are the physical changes we see in girls and boys? In girls, the physical changes includes the breast development, pubic hair growth, axillary hair growth, growth in height and menstruation. So when menstruation first happens or when it happens for the first time, it is known as menarche. It is around 13 years of age. So what are the physical changes seen in boys in puberty? That are testicular enlargement, pubarche. Pubarche is a pubic hair growth, voice deepening and muscle growth. So let's understand more about early puberty. So early puberty is also known as precocious puberty. So it is defined as onset of physical signs of puberty before the age of 8 years in girls and 9 years in boys. And this early puberty is more common in girls than boys. Let's understand how the puberty happens. So you know that inside our brain there is a small center which controls all the hormones, that is hypothalamus. From the hypothalamus, when it is a right age for the child, it will start secreting gonadotropin releasing hormone in a pulsatile form, and this will stimulate the pituitary gland, the anterior pituitary gland, and it will start secreting luteinizing hormone LH and follicular stimulating hormone, that is FSH. And these two hormones will stimulate the ovaries in girls and testes in boys. So ovaries will start secreting the pubertal hormones like estrogen and progesterone, and testes start secreting testosterone. And these hormones plays an important role in this physical changes happens to the body. So what happens in early puberty? So in early puberty, there is early release of gonadotropin releasing hormone, and that will increase LH and FSH, which leading to increased testosterone in boys and estrogen in girls. So what are the causes for this early puberty? So most common is genetic causes, and it can be because of environmental or lifestyle changes, or it can be because of some medical underlying illness. So it can happen like brain tumors, adrenal gland disorders, or ovarian or testicular abnormalities. Next, we'll understand what are the common changes which seen in environment and lifestyle factors which leads to early puberty. The most common is the obesity, especially the childhood obesity and nutrition. So, excess fat increases estrogen production, and lack of physical activity like sedentary lifestyle linked to obesity and hormonal imbalances. Then there are, as researchers have come to a conclusion that there are endocrine disrupting chemicals around our surroundings, like found in plastics, pesticides, cosmetics, and processed foods. Other causes includes psychosocial stress and family dynamics. So chronic stress and early exposure to media content also leads to early puberty. So why this early puberty a concern? Because it has shown impact on the physical, emotional and social well-being. So what are the mental health or emotional challenges? In girls, shorter adult height, irregular periods, obesity are at risk. For boys, faster bone maturation, early muscle development and potential growth issues are other factors which is responsible. So what are the social challenges they face? They may get mood swings, anxiety, depression or low self-esteem. So what are the physical concerns? Like they may feel out of place, early peer pressure, risky behaviors. So these are some of the physical, emotional and social impacts. So how we can tackle this or how we can prevent this? So first or main important thing is avoid high calorie, processed or fatty food so that we can prevent the childhood obesity. This also linked to early puberty. And encourage a balanced diet which is rich in fruits, vegetables, whole grain and lean protein. And limit sugary drinks and refined carbohydrates. And promote regular physical activity. Encourage at least 1 hour of moderate to vigorous physical activity daily. Exercise help regulate body weight and hormones, and delaying this also will help to delay the onset of puberty. And main thing is you have to avoid exposure to endocrine disruptors. So what are those endocrine disruptors? We already seen what are those disruptors. So avoid the plastic containers, then avoid, and you have to choose organic produce to reduce the pesticide exposure, and avoid excess use of hormone containing products like cosmetics and hair treatments. Limit stress and emotional triggers. It's like chronic stress or emotional trauma can contribute to early puberty. Provide a stable, supportive home environment. Encourage mindfulness, relaxation and stress reducing activity. Ensure that the children are getting 9 to 11 hours of sleep per night. Poor sleep and irregular sleep patterns may disrupt the hormone regulation. So how we can manage? So regular checkups help to detect the early puberty, especially with a family history. So consult a pediatric endocrinologist if signs appear before the age of 8 years in girls or 9 years in boys. Homeopathy also offers a natural treatment option for managing early puberty. So let's conclude. So early puberty is a rising concern. Multiple biological and environmental factors contribute to early puberty. So healthy diet and regular exercise helps to prevent it. Reducing the stress and avoiding endocrine disruptors is a key. Early detection and medical evaluation are crucial. Awareness and lifestyle change can delay the puberty onset. So let us join to encourage the awareness and a healthier lifestyle for our children. Thank you.